Right now, a public health crisis in Florida created by shutting down the state's pill mills. Patients with legitimate doctor prescriptions for pain medicine are now routinely turned away at pharmacies.
They aren't drug addicts. They are regular people like you who are suffering from chronic pain, some even battling cancer, some are hospice patients. First Coast News started investigating this back in 2013. And since then, the problem has only gotten worse. Local doctors and pharmacists tell us it has become its own public health crisis and has even led some to commit suicide.
This last time when I was told that they had to validate my medication, I was just, I was upset. You know, I go through this and it's unfair.
And then tell me which ones you have a hard time with.
David Johnson is one of countless Floridians living with chronic pain. For the past decade, he's been battling an autoimmune disease that he says makes life without pain medication practically unbearable.
Essentially, my body thinks I'm the foreign invader, and so it attacks my tissues every month.
2 of his prescriptions are controlled substances. Getting them filled has become a nightmare.
The worst time I ever had, I had to go to 12 pharmacies in one day.
On more than one occasion, he's gone through withdrawal. So who is to blame? That depends on who you ask.
And that there is a tremendous amount of finger pointing going back and forth. The DEA has maintained publicly that they do not restrict any of these substances. That
Dr. Sanford Silverman says the problem started about 2 years ago. Legislation, he says, essentially put pill mills out of business, but also caused collateral damage.
I think it's become a real public health crisis, and patients have died.
Dr. Mark Rubenstein, a pain management physician, has testified on behalf of the DEA in pill mill cases.
Now the pendulum has shifted the other way, where we're having a true access problem for patients who have legitimate medical needs.
It's a conversation Jacksonville pharmacist Bill Napier, owner of Panama Pharmacy, says he has every day with patients.
We had 2 patients I know of who got tired of the battle and committed suicide. I know the DEA says they don't set any quotas. My wholesaler says they set quotas in response to DEA pressure.
Napier says he's being forced to ration medication. He came up with this checklist to determine which patients can get their pain medications filled. At his pharmacy, they must be over the age of 35, undergo a criminal background check, and their doctor must be vetted.
They're just out of luck. Especially towards the end of the month, I have a lot of people that say, well, my pharmacy's out of it. And I try to explain that every pharmacy's out of it because every pharmacy has a quota.
Special Agent Mia Rowe with the DEA says her agency is aware of the problem and concerned. But she is adamant the DEA does not set quotas for how much a distributor can sell to a pharmacy or how much a pharmacy can purchase from the wholesaler.
I wish that we could say there was an easy answer, but we really don't know. Why? I think the DEA has become a convenient excuse for many pharmacies not to fill prescriptions. But I do want pharmacists to know that they do not have to fear DEA for doing their jobs, for filling legitimate patients' prescriptions.
That DEA have been the least responsive agency I have worked with in my entire career.
Congresswoman Corrine Brown believes, quote, the root of the problem seems to lie with overzealous or excessive crackdowns by DEA officials.
You know, we have gone to the extreme.
Brown and Congressman Andrew Crenshaw wrote a bipartisan letter to Attorney General Eric Holder last September, requesting the DEA hold a conference in Northeast Florida with stakeholders to address the problem.
No response. This is over 6 months. Unacceptable.
Do you believe this is a public health crisis?
Absolutely. And this is not the law. This is DEA interpretation.
You know, part of the problem is that the DEA is not only a law enforcement agency, but they're also a regulatory body. And so they have an unprecedented amount of power.
Johnson is now on a mission to fight for patients' rights. He created the website paincareislegal.com, and within a few weeks already has hundreds of supporters. Supporters he is urging to sign a petition he started to get the White House to address the problem.
They should spend just one day in pain and withdrawal to know what it's like for people like me that have to go through that.
Now, Congresswoman Brown tells me she plans to ask House leadership to hold a hearing to address this problem, and she says she's also working with state leaders to arrange a meeting here in Florida. And we've been asking you at home to weigh in. We have received hundreds of comments. Heather Gibson writes, "My brother has cancer and had to go to 7 different pharmacies the day before yesterday to get his prescriptions filled." She goes on to say, "It's utterly ridiculous." And here's what Rick Sprinkle writes. He says, "It's because of the bad doctors and drug abusers that screwed up the system. Those are the ones to be mad at, not the pharmacists." And you can share your stories on our Facebook and Twitter pages. Just use #MedsDenied.
Well,